Welcome to CareCast. I'm your host, Tim Cavanaugh.
And I'm your co-host, Amy Bishke. Tim, I have missed you. I haven't gotten to record a CareCast with you in so long.
Amy, I'm going to say it was February last time we got to talk together, but did you know September is Hydrocephalus Awareness Month, Amy? And we've got two very special guests joining us from our partners at Aesculap, and we're going to be talking about hydrocephalus. So let's meet our two guests today. We've got Kelly. You want to introduce yourself?
Yes, my name is Kelly Cook. I'm a clinical consultant. I work in the neuro division of AIC, specifically with the hydrocephalus shunt product line. And it's great to be here. Thank you.
Hi, Kelly.
Thanks, Kelly. And Christoph, would you mind introducing yourself?
Yeah, well, hello to everybody. It's a pleasure to join. And my name is Christoph Mietke. I am a mechanical engineer. I started a business, my company 28 years ago, and all the time I've been simply focusing on the treatment of hydrocephalus, developing new devices, and focusing on this hydrocephalus aspects.
Awesome. We are so excited to have both of you here sharing your expertise with us and our listeners. And we really want to kick it off. Christoph, would you mind explaining to us and our viewers what exactly hydrocephalus is?
Well, actually, hydrocephalus is a term I personally do not really like. It's you could translate it in water in the brain, yeah. And well, all of us, we have a brain inside our skull, and this is surrounded by water, and this is going to be produced, or liquid, and this is going to be produced and resorbed, and there's specific pressure situations required to live a normal life. And people with hydrocephalus have somehow a problem with that. The pressure is too high or too low, or the volume is too small. So this is somehow an explanation of hydrocephalus.
Okay.
Pretty interesting. Good to know. Kelly, anything that you'd like to add on hydrocephalus and a definition of it for our viewers?
Certainly. Our brains produce about 500 cc's of CSF on a daily basis. And
CSF, I'm going to stop you. What is that? What is CSF?
Yes, that is cerebral spinal fluid, and it is continuously absorbed and continuously replenished within our system. And if you'll imagine in your mind a really a vintage balance scale, well, there's a very, very delicate balance that occurs between CSF production on one side of the scale and CSF absorption on the other side of the scale. And when that balance is disrupted, then hydrocephalus will occur.
So Tim and I kind of briefly talked to you before the CareCast about our backgrounds, and we both have a little bit of a pediatric background. We both agree that we've seen hydrocephalus in this patient population. But is that all that it affects? Who does hydrocephalus affect, Kelly?
Well, for those that are born with it, that's present at birth, that's known as congenital hydrocephalus. And other than that, it can also occur anytime during the lifespan, and that's known as acquired hydrocephalus. And typically, this type of hydrocephalus is a side effect of a primary diagnosis.
Is acquired hydrocephalus as common as what we would see in the pediatric environment, Kelly?
It is. It runs the gamut in terms of the lifespan, yes.
Okay. And, from a nurse's perspective, if we have a patient come in, what might be some signs and symptoms that might give us a clue that this person might be suffering from hydrocephalus?
Certainly, from the pediatric patient's standpoint, classic symptoms will be from an infant to a toddler to a child. There will be less interest in feeding and eating, difficulty swallowing, vomiting, irritability, sleepiness. The young child may complain that his head hurts, and he may also complain of visual disturbances. Classic signs may include, of course, an expanding head circumference. In terms of infants, their fontanelles may bulge, their cranial suture lines may split, and the scalp veins may become very, very prominent and dilated. They may exhibit seizures. They may exhibit what's called sunsetting of the eyes, which is a downward gaze. They lack the ability to look straight ahead or up because of the pressure within the cranium. They may present with seizures. stridor, which of course is a high-pitched breath sound, as well as bradycardia.
Excellent.
Wow.
And
Thank you so much.
Christoph, patient arrives, we see these signs and symptoms. How would hydrocephalus be diagnosed in a medical environment?
Well, actually, it depends definitely on the kind of hydrocephalus, on the type. Kelly mentioned pediatric hydrocephalus, for example, and other examples acquired, or there is a specific type of hydrocephalus called normal pressure hydrocephalus, which very often occurs without understanding why it occurs and why people have this normal pressure hydrocephalus. And the diagnosis for this kind of hydrocephalus completely different to the pediatric situation, where you easily see the high pressure because the skull of the baby, the newborn, is increasing in a very unnormal way. This in adult patients you cannot see. So then you have clinical signs to investigate whether or not they might have hydrocephalus. And with the elderly patients, it's definitely a difficult situation to differentiate between different illnesses, saying, well, you could have partially Alzheimer's and normal pressure hydrocephalus, and the differentiation is not that easily done.
Okay. Kelly, I think I know the answer to the next question. It's a little bit loaded. Do we have a cure yet for hydrocephalus?
Generally speaking, there is no cure for hydrocephalus, and it's a condition that requires lifelong management. It really does.
Lifelong management, so treatment. What kind of treatment options might we offer patients suffering?
Yeah, I heard Christoph say something about a surgery.
Right, absolutely. Well, some neurosurgeons, there's micro neurosurgeries, so they will go and perform a craniotomy and under the microscope remove the cyst or the tumor that's causing the obstruction. There's also what's known as an endoscopic third ventriculostomies that pediatric surgeons will perform when there's a specific anatomical obstruction that's causing the hydrocephalus. And an endoscopic third vent, as it's, or an ETV, that occurs. What a surgeon will do is he will create a hole in the floor of the third ventricle to recreate the CSF flow pathway. Another procedure that's done in tandem with an ETV is what's known as a choroid plexus cauterization, or a CPC. So choroid plexus is actually these capillary beds that float about in the ventricles, and that is where CSF is produced. And so by reducing the amount of that tissue, in essence, you're reducing the overall production of CSF. So in essence, again, the intent is to rebalance that scale of production on one side of the scale and absorption on the other side of the scale.
Oh, wow. That is amazing. I didn't know that there were so many different surgical options or treatments. When I think of hydrocephalus patients, from what I've seen, I typically think of shunts.
Absolutely. And that is one of the more common treatment modalities. And the intent is to divert the CSF from the ventricles to another body cavity. And typically that body cavity is the abdominal cavity or the peritoneal cavity. And the procedure that's performed is a ventriculoperitoneal shunt, or for short, VP shunt.
A VP
shunt? Yes, a VP shunt. And so in essence, within that VP shunt system is a valve, and the valve is what is going to regulate the pressure of the CSF flow.
It's like a faucet.
It is. It's like plumbing.
All right, now that we've learned all about hydrocephalus, and probably more than you already knew about hydrocephalus before, we're going to take a brief pause so that we can get ready to tell you about the different treatments for hydrocephalus. I am confident to say you're going to learn a lot more about hydrocephalus treatments than you thought. You might even be surprised to find that there are more than one type of shunt. So stay tuned. We'll see you back here soon.